So Margaret's going to go through a whole piece on proper practices around PPE, mask wearing, sanitization, and other pieces that she'll fill you in on. This whole video will be recorded and it will be on our website. So, you know, it's for, if you need to show families, do so, right? The more safety practices that we put out there with the virus that's coming, the better off we're gonna be. I know you've had a couple of communications from me around Easter. So we're good for outside visiting starting on Thursday, the 1st, because it's gonna be warm, and people can go home on Easter Sunday. So go to the website to do that booking, right? If you want to take them home, it's outside visitations is one section and taking them home is on another section. So I'm going to turn it over to Margaret. Thank you so much for joining us because it's so important. We've got through a good year here and we need to keep it going. So take it away, Margaret.
Hey, good afternoon.
Margaret, before you get going.
Okay.
Families, just make sure now that we're doing, going into this, if you could please just mute yourself so we don't have any extra feedback or anything like that.
How do I know if it's
And we'll have a question.
Yeah, there'll
right?
be Q&A afterwards. You can unmute when I'm done.
So
It'll take 10 minutes.
Yeah, so what we'll do is we'll hold questions to the end. I am going to make her screen bigger, so it should show up. It should show up full size on your end. It'll show up full size on ours. So as soon as she's done the presentation, I'll go back to this view and you can unmute and then ask your questions, okay? Thumbs up and we'll get going here.
Okay, good afternoon. I'm Margaret Donnelly. I'm your nurse here at Riverwood.
You clicked over there, go back. There's Jude.
Okay, is everybody in?
Oh, we're way too far apart here.
I can carry on, Brian? Okay, anyways, I'm Margaret Donnelly. I'm the nurse at Riverwood Square. Good afternoon. Glad you've joined us. And I don't mean to have my back to the residents here. I apologize, so I'm going back and forth. Anyways, today is not about wearing all PPE. It's about only mask wearing. Right now I have my goggles on, so I'm going to remove them and I will put them over here. Anyways, so with things opening up right now, there is still a risk of spreading viruses, whether it's COVID,
My legs.
flu, could be colds or anything. Over the last year and a half, we've actually seen a lot of influenza and cold viruses are lower. We don't have as many because we have been wearing masks. We've been hand sanitizing like crazy. However, and we probably had the flu shot. However, COVID is a very strong strain of a virus. And it's amazingly strong, and now it's mutated, and we have the kind of variants, right? And that's what viruses do. So unfortunately, viruses, they love anything. They love people, they love animals, they love surfaces. I don't know if you see me walk around in the facility. A lot of times I am walking around a lot of times like this. I purposely walk around doing this, not because I want to punch somebody, but because I don't want to touch anything, especially my face. I don't want to touch surfaces unless I actually have to, because viruses can live on surfaces 72 hours, 96 hours, depending on the virus. And I'm sure you may have read this in the news. So going forward, now that we are going to be visiting, families are going to be coming into the facility to have outdoor visits, as well as coming in on Sunday to have a visit, you know, starting this Sunday for Easter, etc. There is a proper procedure to wear face masks. Riverwood Square will be think Linda may have sent an email, I'm not sure, but you can purchase $1 per dollar, like a medical grade mask for $1. They're not cheap. They're better than cloth masks. Cloth masks do not provide the safety for whether you're around somebody who's unwell or yourself. We need something a little that has more oomph to it, which are these medical grade masks that I'm wearing right now. So anyways, I'm going to go kind of to the side here. I'm going to actually remove my mask, and assuming I have somewhere to put it down safely. So when I enter a facility, any facility, I will, at each, when you enter a facility, you'll have a hand wash station. So you always do hand hygiene. Always wait until the hand sanitizer is dry before you start doing anything, because it doesn't provide you that protection if it's wet and you start doing things, all right? It has to be absorbed into your skin. So you hand sanitize, and if you're familiar with Riverwood Square, when you walk in, there's a foot bath. You should be doing the foot bath. When you come in from outdoors and you're wearing, let's say, a cloth mask, you will, like I said, you can purchase a $1 medical grade mask, or if you have the option of buying your own medical grade mask, if you know somebody, or have a web portal you can go to. Anyways, so when you come in, you should never ever actually touch the inside or the outside of your mask. How I typically do it is, I'm gonna take this one off, I'm gonna put it down, and I'm gonna grab another one. Usually I will have, whenever I take my mask off, I will always put my mask on a piece of tissue if I can reuse it. Masks should never be reused if they're soiled or wet. They should be changed every time you go somewhere. You shouldn't be wearing the same mask over and over and over again, because you're breathing in stuff, some particles release, so you're higher risk for spreading and the mask can deteriorate. So here, this is what we do at Riverwood Square, and a lot of facilities do this. They'll hand you a paper bag if you go visiting in the hospital or in personal care homes. They'll give you a baggie with the PPE that you require. Here at Riverwood, it's just a mask, unless we were in a code red zone where we needed full PPE, but by then we'd be isolating again and we wouldn't be having anybody come into the facility. Anyway, so when you come in, you will hand sanitize. You're gonna do your foot wash. You'll have a mask. Do not touch your face. If you do, you always hand sanitize. I would suggest that you always carry your own sanitizer on your person. I carry some in my purse, so wherever I go, I spray. For an example, what I always do is sometimes if I'm purchasing something and my card, I go to tap it, it doesn't work, I have to insert it. I know they probably cleaned it, but I didn't see them clean it. So I hand sanitize and I spray myself, all right? Because we can't make assumptions that somebody else is doing it for us. Always be on the alert. I'm not trying to make anybody nervous, but be on the alert. I was like this before COVID, that you have to rely on your own instincts and do for yourself. All right, so I got my mask, I'm pulling it out. All medical grade masks will have a metal piece. So it's this part right here, right on top, and that goes to the nose. Okay, it's really hard to see, but you'll feel it. There's a little white strip there that indicates that's the nose piece. So what I typically do is, and you have to make sure I hold it like this. You guys, everybody see? Okay, I don't touch my face. It's on, but I gotta pull it up. So I'm gonna lightly touch and open it up so the pleats are open. And then the metal piece, so I'm sealed, all right? It should fit snugly in here. I have a smaller face in here, so sometimes I have to double loop my ear loops. The less you touch, the better it is, because let's say if I'm going, and I'm gonna go see Gerald here, and I touch my mask and I touch him, That's called a breach. So when you're coming to visit your families, if you touch your mask and then you touch them, that's a breach. You should change your mask. All right. So I'm visiting Gerald here. Sorry, is it okay if I said your name? Anyways, I still should maintain that 2-meter distance or that 6 feet. I shouldn't be going up and hugging him. My father's in a PCH and my mom is in assisted living. It's the same thing. I don't have those options. And even though I'm in my mother's suite, I still wear my mask. She has been immunized. I have been immunized, but we can still carry viruses, the variant, and we can carry it and spread it. That next person may get it, and if they're not immunized, may get very sick. If they're immunized, they're saying less symptoms, not as bad. But we don't know, so it's always better to be prepared and be safe. Okay? All right. So let's say now you're going home, your visitation is done. So residents should be wearing a mask as well, just not family members. It's all of us. So when I run around the facility, you'll see me with the shield on, especially if I'm in a prolonged contact of 10 minutes or longer. Sometimes I'm running up and down those stairs. I get short of breath, but I wear it still, my mask and my goggles. So when you have that prolonged exposure for 10 minutes or over, you're higher risk for spreading any type of infection. Could be influenza. All right. Now it's time to leave. So I'm leaving. I leave and I'm going out of the facility. As long as I didn't touch my mask, I can wear that to my vehicle. But before you leave, you hand sanitize again. So when you're in the resident suite as well, though, I forgot to mention, try not to touch the surfaces. Nothing. Keep your hands like this. I walk around like this sometimes, but it stops me from touching things. And I always hand sanitize. Usually I carry around a box and I'm hand sanitizing all over the place. And there's lots of hand sanitization stations throughout the building as well. All right, so when you leave, that's great. Let's say you're in your car and you want to take your mask off. Fine. So same principles, using your fingers, you remove the loops. Do not touch the inside or the outside of the mask because those are the areas that can be contaminated from myself or from other people. You put it in the garbage, you can break the loops as well, and then you should always hand sanitize. After every piece of PPE removal or before putting it on, hand sanitize. So we call this in the medical world, I don't know if I have any medical people here, but donning and doffing of PPE. And it's a very simple principle. Okay, I think I'm done. We'll go to Brian, who can, everybody can unmute and maybe ask some questions, if there's any questions.
Yeah, I have a question about masks. You said that cloth masks were not as good as the medical masks.
No.
And I was just wondering, I bought some masks from CAA. They're kind of, I think they've got some nylon in them. Are those just as bad as cloth?
Probably.
Yeah.
It doesn't provide, but you know what? I'm following what the WRHA is telling me. So
Yeah.
You can go on the Shared Health website and they're going to tell you exactly what I'm telling you about when you're entering a medical facility and that these are better in Canada. Now, yeah. I'm not saying outside in the public, if you feel you're comfortable and you're still doing that 6 meter or 2 meter distancing, it's probably okay. But you don't know, they're finding more and more cases outside. Now, whether people are wearing their masks or not, I don't know, and the type of mask. I'd rather be safer and wear my medical grade mask. And I have cloth masks initially, but I don't wear them at all anymore. I used to wear them and wash them immediately, like 24 weeks, I'll wear them but I don't, I just wear this.
Yeah, okay, thank you.
You're very welcome. Anybody else?
I have a question.
Yep.
Sorry, I joined a bit late.
Okay.
but you may have covered this. Could you please tell me what a medical mask is? Is it just the blue ones that people are handing out, or?
It can be blue or white. And a medical grade mask, there are different, Heather, we can find a portal for the medical, not through the WHA, but another portal. I'll give you a name but you would have to get, like Cardinal Health sells medical grade masks. So if you go on the internet, I mean, on the internet, you may find masks that they're saying they're medical grade, but I wouldn't trust that. So actually, I would suggest you reaching out to the WHA, Shared Health, there's a contact number. I mean, I'm provided because I am in the medical field. And we can provide you masks here for, like I said, I think Linda said it'll be $1 a mask because we pay for these masks to come into our facility, so.
Is it the N95 masks you require?
Nope, not an N95. N95, you have to be tested and fitted for an N95. This is a medical grade mask. N95 is something different. N95 is only used if you are in a code red zone. We're code green right now. We don't have any outbreak. We haven't had any outbreaks here, so we're good. And now that the residents are vaccinated and most of the staff we're better, but doesn't mean we let our guard down. So
When
yes.
arriving, you want us to put our masks on before we leave the car or at the door?
You know what, if this, I would say you can wear your regular mask to the door, but you'll get a mask at the door.
Okay.
Yeah,
Okay.
I don't know logistics about that. We're working on that.
Okay, I saw some hands go up for Liz. I saw you there. We'll do you first.
Yeah, you
Okay,
be,
thank you. So my mom, probably like many of the residents, is very, very hard of hearing. And we have a couple of these masks with the windows in them, but they are not medical grade, right? So I'm just wondering how we best manage the situation when she really needs to read my lips to hear what I'm saying.
ooh. You know what, what's gonna happen have you been immunized for starters?
I haven't.
No, so you'd be actually putting, and I don't want to be negative, and I
Nope.
have to share that with me, but you know, we are higher risk for spreading to somebody else.
Yep.
Even though, let's say it was a variant you had and you spread it to your mother,
Mhm.
even though she's immunized and it's by Sunday, it's going to be 2 weeks or whatever from the second one, you
Yeah.
could pass a variant to her. She may not get that sick or not get sick at all.
Mhm.
So I know hard of hearing is, from experience, my mom has hearing aids and
Yeah.
sometimes I'm yelling at the top of my lungs.
Right, but we should still wear the medical mask.
Yes, I would definitely.
That's fine, thank you. I appreciate the clarification.
Okay.
Candace, I see your hand up.
Thanks, Brian. I bought what appears to be medical grade masks from Costco. Do you know if what they carry is acceptable?
You know what? Send an email to myself or to Linda and we'll check it out. Because I'd have to see the mask.
I have those from Costco.
Yeah, they're blue and you can I've seen them at gas stations, these blue masks, but it doesn't mean they're medical grade.
Okay, the other point I was going to make to the lady who has a resident who's hard of hearing, I've found a message board, a dry erase message board like this one, indispensable. My mom
Yes.
cannot hear me at the best of times and certainly not with a mask over my mouth, but
Yeah.
her reading comprehension is fine. And this is the way we have to communicate, so.
Yeah, I think it was, there's so many people coming and going, yes, good point. And I use that for just general purposes anyways for certain residents. Thank you.
Jerry Ramsey, I saw, is your hand up there?
Yes, thank you. I was just curious, the residents, are they being provided with the medical grade masks to wear themselves? 'Cause I
Yes,
know
they are.
Okay, so they're not using their cloth
Well, I
ones
see
at all?
somebody wearing their own,
Yeah.
but they are, like, I'm not pointing out figures, but they are provided if they want their medical grade masks. And I protective face masks. Can you send a photo of it?
Sure.
That's Costco, yeah. You know what? Actually, what I would probably do, I'm sorry, what's your name?
Candace?
You know what, Candace?
Hi.
I would phone Shared Health. There's will be a contact, Meds Up, and they'll let you know for sure if those, they look like they are, but I mean.
This particular brand fits me much better than the type that you're wearing, because I also have a small.
Yeah, so actually this one is better than the one that I had on previously. So, and that's why I said that you want to make sure it fits snug, because the less you touch it, the safer you are. Yeah, but yeah.
Sorry about that, Jerry. We'll finish up with you.
Yeah.
Jerry, did you have any more?
No, that's good. Thank you.
Okay.
Okay.
I see a hand up for Judy in the top corner there.
Thank you. So I just want to clarify, because it's kind of gotten a bit confusing. I have what I believe to be medical masks, medical grade masks. So if I enter the facility wearing that mask, I don't have to purchase one for you. Is that my understanding, or do I need to purchase one from you?
And that's what I would prefer, and I mean, for you guys to come in with whatever mask you're wearing, because I don't know where you got these masks from. So I could go through all, let's say 30 of you, but I don't know where these masks came from. I would prefer you to buy, and it's not to gain money. It's because we know what you're wearing.
Well, so you either have to say that or you don't, because, you know, I actually do have medical grade masks because I do work in a healthcare facility, but you don't know that that's the correct mask.
Yeah.
Nor do the people who are at the desk. So you either need to say you need to buy one at the facility, or
Well,
what
I have to check with Linda, and that's what we're working on. That's the logistics. I don't know. We're working on that, but that's what I'd like to see.
But you've confused the issue is what I'm saying.
Yeah, no, I apologize, yes.
I see Karen, I saw your number up there, your hand up there.
Yes, thank you. I just missed the very beginning. Did I hear someone say that that we're allowed to go into resident suites now? Or did I just hear that?
That was Linda saying, busy, not into.
I think, yeah, it's not quite yet.
Not quite there.
Not quite yet?
Okay. We're hoping.
Okay.
It's
Okay.
up for a visit starting on Thursday.
Yeah.
Correct.
Yeah.
Okay.
Okay.
Okay, so I've got Shirley, Dan and Shirley up there.
Yeah. Good. Yeah, I just want a little clarification, and the previous question sort of touched on that about visitation in the suites, and you guys aren't quite ready for that, and I understand that. But you mentioned home visits. Now, what does that mean? Like, can we take them out for Easter to a small little family gathering that we think is safe?
That's what, yes. So you can take, I guess Sunday, Linda said?
Yeah.
Out for Easter, yes.
Oh, okay.
Yeah.
Okay.
Eventually,
Well,
we're
that's
hoping
great.
for when you come into the suites. So I sort of provided a long drawn out, but when you go home, let's say you take a loved one home for Easter. So touching of surfaces, any surfaces, how you put your PPE on, your mask, like I'm saying, is important. Okay.
And then
Yes.
And then just
Okay,
please,
thank
and then just please book your appointment that you're taking your loved one out on our Riverwood Square website. So on the top right-hand corner of the website, you'll see a place that says book online, and then you'll get 3 tabs that'll come up, and it's the third one, and it says resident outing. So you'll just fill in the day, the time, just so we know that your loved one's going out, please.
Great.
Great.
Thank you very much.
Thanks.
I'm gonna do, I saw Jackie come up, and then we're gonna do Pam, and then we'll go back to Candace.
I'm trying to follow
Yes.
you.
Oh, Jackie, you're still unmuted, sorry.
I'm not on mute now. I just had a question about these outdoor visits. Is there a time limit? If the weather is not favorable, what happens? And what location is it?
Linda said outdoor visits only, currently 30-minute time limit. So if the weather's not favorable, I can't answer that right now. The decision would be made if we were moving them to inside. My understanding, outdoor visits only at this time.
Is that good, Jackie? Anything else?
The other question, and I guess your email said 2 visitors at a time, but they must be from the same household. Is that correct?
Same family.
Yes, yeah, it's kind of like the restaurant rules,
Oh.
coming to visit, same household kind of thing.
Oh, right. Okay, that's it. Thank you.
Perfect. Okay, Pam, I think we're coming to you next.
Someone just mentioned booking, taking a resident out of the building, and I got into trouble last time I did that for a doctor's appointment because I was told you could not use the online booking for that, taking the resident out. You had to book directly with, I have the person's name written down, but someone from WHRA.
No, right, we're full swing with our booking system.
Yeah.
So anything you book there, that's good as it goes, and that's the book we're going by.
Is that new?
No?
I'm not sure why you were told that. I don't know.
Yeah.
No.
Okay.
The only restriction we had on the website when you went to that was like, we only recommended if you were taking residents out for essential doctor's visits, if it could be delayed.
Right.
But,
Yeah.
I mean, you still, if you have a doctor's appointment that you have to go to, I mean, yeah, we were allowing that.
Right. Okay, thank you. I feel better now.
So Candace, will go to you, and then I gotta switch the pages. I'm hoping we're not missing anybody on that second page, so.
Okay, I just wanted to follow up on the taking a resident out for a visit in your home, that the public health orders still apply. You can only have 2 designated people in your home. It must be the same people or one other household. So I hope everybody keeps that in mind this Easter, that it doesn't mean you can bring all your family in for Easter dinner. You're still limited by public health orders.
And Candace says perfect, and that's why we are relying on you guys as loved ones to follow the same rules that we all do here. So thank you for bringing that up, Candace. You know what? We all have the information at our fingertips. You're all online here. So checking out the Shared Health website is very, very important. Yeah, I mean, we all got to do our own part.
Maureen, I saw your hand come up there. I know you're a new one there.
Hi, my mom's in Harmony Court, and we've booked a visit for Friday. Now it's going to be outdoors. So can my sister and I not come? We're not in the same household, but like that, the public health rules are like 10 for outdoors. So how does that work?
Outdoor.
Yeah, I can't see why not, because I agree. As long as you're still your 2 feet distance or 6 feet distance, yeah. But we gotta check with Linda too.
We'll have to check with Linda, but then Jackie, I guess that changes the answer I gave you. So we'll finalize with Linda about that. Maureen, you make a good point because of the changed one. So we'll finalize that, and we should have that information for you ASAP.
Okay, because it's like outdoors, right? Like we're not going in. So I assume, I don't know.
We'll confirm that ASAP.
We're working on a lot of logistics here right now, so we may not have all the answers, and I apologize, but this is
I know
coming up, so.
Okay, thank you.
Jackie, did you have a second question?
Yeah. No.
No, we're good. Just the hand was still up. All right, who are we looking else for questions here?
Oh, I still have one.
Karen still has one, and then we'll go back.
I still have
to
one.
Shirley.
Okay. You say that it's starting on Easter that we could take our family, our mother out. What if someone's having Easter dinner on the Monday? Does that still apply?
Yeah.
Yeah. Okay. Good. Okay. Thanks.
Okay.
Because you can't take them out any earlier than Sunday, because that's the 2 weeks.
Yeah.
Oh, okay.
All right.
They have their
Shirley?
last dose March.
Yeah, I just wondered, like, is this only applicable now for Easter, or can we start to take my mom out every so often to bring her to someone's place as long as we're following the proper protocol?
Well, just like, and I'm gonna answer that because that's a tough one. So because the 2 weeks is up for the residents having their vaccinations, and if any of you have been vaccinated, awesome. But we don't know what's gonna happen like at Easter. just like Thanksgiving. And then all of a sudden we had that second wave hit. So we're treading very cautiously. So we'll see what will happen on Sunday or Monday, and then we'll go from there.
Okay.
We don't want to jump the gun. We want to make sure everybody's safe. And we can't control everybody and what they're doing.
Yeah. Okay, thank you.
Jerry, did you have a second one?
I do. It's just a follow-up to the lady who talked about the how important it is that everybody adheres to all the rules and regulations that are out there for absolute sure. So I was just curious, and it obviously puts more work on someone's their plate. But when people book out those visits with their loved ones, is there an opportunity to have a statement there where they have to sign off saying that they have read and are aware of what the regulations are at that particular point in time, and sort of committed on in writing per se to Riverwood that they will adhere by those, just giving it that one more step?
Possibly, I'd have to check with Linda because it's a booking system we use, but when you go into to book it, Linda has outlined all the restrictions on that first page. When you click on the little picture, she's kind of outlined all the shared health guidelines that you have to adhere to. So I don't know if there was another way that we could get you to sign something.
Yeah, even a little box saying I understand and have read the information.
Right? We can look into that. Yeah.
Thank you.
I think maybe some of you Misty, front reception was always asking all the questions. Now we've gone back to self-screening, how it was kind of maybe last year at some point. So, we got to take ownership, everybody. Yes, sorry. Candace, yeah. She moved around.
Yeah, I know. They kind of jump around. Candace, before you start iPad 2, Lydia? Yeah, do you have a question?
Yes, this is a little bit off base perhaps, but I was surprised at the low figure of staff that had been inoculated. I think it was 52%. My concern is that with these variants increasing in number and scope, are you at all concerned about these variants somehow entering the facility through the staff and affecting the residents who have been vaccinated, obviously, but who might not be completely safe when it comes to these variants? And I was wondering if you had a program in place where the staff, the workers were being encouraged to be vaccinated. And well, first of all, perhaps the 52% is no longer valid. Maybe more have been vaccinated since we got the email. But I was just wondering if you are as concerned as I am, to tell you the truth.
Yes, I'll speak to that definitely. Very concerned. Unfortunately, we can't force people to get the vaccination. It's like with any vaccination, you can refuse diphtheria, polio, anything. And I've seen this over my years as a nurse that people have chosen not to immunize their newborns, 2-month-olds, and at the time of a vaccination. We encourage, we do have a program here that encourages them, it gives them incentive to get the vaccine. I've actually talked to a couple staff on my roads and travels when I'm running through the facility and have encouraged that vaccine. So there is, I think the percentage is higher, but unfortunately we cannot. It is not a mandatory thing.
Right. No, I appreciate that. Thank you.
But we're pushing, well, not pushing. We're not pushing it. We're encouraging it. It's the wrong word.
Yeah.
That's all we can do.
Yeah.
So Candace, we cut you off. We'll go Candace. We'll go Liz after that.
Yeah, thanks. If you could
Liz,
just,
we'll go Candace first and then you.
pardon me.
Sorry, in the notification that went out to families about this Zoom session, there's a line in here that says visitors must sanitize behind themselves. What does that mean?
It's exactly what it sounds like.
Is this something to do with Charmin or?
I wish I knew. I didn't.
I am not kidding.
Or be like sanitizing, like let's say you go touch an elevator button,
Yeah.
sanitize that elevator button,
Yeah.
kind of behind you as in, covering your steps as you go.
Okay, with what? Are we going to have wipes of some sort with us or?
Well, in the outside visit area, we will have sanitizer and wipes for you to snap. We won't have staff on duty to do that. So we would ask family after you've done your 30-minute visit, if you're visiting outside, to sanitize the area, and we will have that supplies available to you.
Okay.
All right, Liz.
Okay, so if you would just help me to be sure that I'm interpreting the health guidelines correctly. If I were to bring my mom home to my home where my husband and my son and I live, then 2 or 3 weeks later, she should not go to my sister's home and visit because we would be her people then. Is that correct?
Yeah, so that's that bubble that we're talking about. Yeah.
Okay, I thought so. I just want to be sure before we do something that we can't walk back. So thank you.
Yeah, and we just want to see what happens after this Sunday and Monday. It's uncharted territory. And going back to Lydia, another thing is that's why the proper use of donning and doffing our mask and hand sanitization. That's where this is what I'm getting at, is that we want to move forward, but we still should be cautious, right? And protect ourselves as well as the residents, etc. Okay.
Before I come back to you, Jerry, because I still see your hand up, is there anybody new, anybody new with new questions that had anything to say? Oh, I think we're okay. Jerry, you just took it down. You don't have a question anymore?
Say that again, Brian. Oh, sorry.
I'm just wondering if there are any new people. Oh, it looks like we have Margaret Graham down in the corner here, and then Jim Fisher. So we'll do Margaret Graham square, and then we'll do Jim Fisher after that. Yes, no, maybe. I guess while we're waiting for Margaret, we'll do Jim. What can we do for you, Jim?
Yeah, I was just curious, the outdoor visits, if you're from one family, someone asked about whether 2 people could come, and that seemed okay, but if you're from the same family and you had 3 people who are outdoors, that wasn't clear. So if you can clarify that somehow, that'd be great.
I think as of right now, we're going to keep it at 2.
Okay.
Yeah.
Fine. Thanks.
Any other questions? No, I think they might just be adjusting. Fine. Okay, I think that could be it. I think so. All right, Margaret. All
right.
Let you do your finale here, and then.
All right. Well, I want to see if any residents, any questions?
Nope.
Okay. I think that's it. If you want to reach out to me at any time, you certainly can. I'm in the directory. Don't ask me what my cell phone number is because I don't remember it. Oh wait, is that a hand up? No? Okay. Yeah. Okay. Anyways, if there's any questions, I really enjoy being here with you and being with the residents and
Come in.
Oh, Lydia?
No, sorry.
Okay. All right. If there's any other questions, please feel free to contact me. Yeah.
Well, thank you very much. It was very informative.
Yeah.
Thank you.
Thank you. All right. Take care. Have a great day. Happy Easter. Passover.
Thank you so much.
You're welcome.
Thank you. Okay. Well.
I love how they just all of a sudden disappear. technology.